The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you gotta get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
We go. Hey folks, thanks for joining us here on the Predictive Health Clinic. I'm joined today by Dr. Robert Lufkin, who I had the privilege of talking with on Dr. Obesity's show, author of Lies I Taught in Medical School. By the way, I love that title. Fantastic title.
Oh, thanks, Jack. Yeah, it's great to be here today. I'm a fan of your work, and so this is going to be fun.
Well, I appreciate it. As you know, Predictive Health Clinic focuses on actionable steps that our listeners can take to predict or prevent or recover from some particular health issue. So what's the health issue you want to talk about today?
I want to talk about the health issue that's affecting most adults have this, and that's chronic disease. There's literally a tsunami of chronic disease. And by that, I mean everything from obesity, diabetes, cardiovascular disease, high blood pressure, stroke, heart attack, cancer, Alzheimer's, and mental illness, all of those things. And the things I'm going to talk about that improve my risk for those diseases will actually work for all of them. And that was a wake-up call that I wasn't aware of in my journey, even though I was a medical school professor.
Yeah, I like how you framed that. When you said chronic disease, I thought, wait, this is way too broad for a single issue. But to bring it all back together as the same actions can reduce your risk of all of those. All right. Typically, what I will say here is what interested you, what got you first interested in this. But I think we might ought to deviate just a little bit. Your book, Lies I Taught in Medical School, addresses this kind of stuff. So if you don't mind, give us a little bit of the lies you taught in medical school. That will answer the question, why are you interested? What are the misconceptions? And what's the truth about this issue?
On a broad level, the lies that I taught, and many of and they weren't lies, they weren't intentional lies, but these are things that I believe now are not true. And I think the evidence is very strong. And I used to think otherwise, and many of my colleagues still believe these things. And that is these chronic diseases that I just mentioned are really unrelated, and they all have separate causes and they all have separate treatments. That's the overarching thing. And we can go into each one of those before. The problem is, I'm a product of the healthcare system. I love the healthcare system. It was great in the 20th century. It truly transformed our lives. And, it through public health measures, it made the world a better place. The pills and surgery changed things. But the thing I'm talking about in the book is these chronic diseases that are now a tidal wave in the 21st century, taking up 80% of our healthcare resources. And when Western medicine applies the same pills and surgery to these chronic diseases, they may work for the symptoms and actually make people feel better. But in most cases, they don't do anything for the underlying cause, which is the same cause or a similar cause for all of them, which is metabolic disease, which continues to get worse and worse. That's really the theme of the book in a nutshell. And that was my wake-up call when I came down with 4 of those diseases, and I kind of went through the grinder on it.
4. Wow. Just parenthetically, I was watching football yesterday, and it was really hard not to notice that pretty much every other ad was an ad for drugs. And one of the ads literally said, if you're taking medicine for this thing and it's caused these side effects, then this medicine that we're advertising will help with those side effects. And I thought, what madness, what utter madness.
Yeah, I mean, those ads, that is illegal in every country in the world except for the United States and New Zealand. And you have to ask yourself, are we that smart that we know something that the rest of the world doesn't know? Anyway, that's a whole nother conversation.
I was talking to Dr. William Davis last week. He was back on Phil's show for the second time. And he quoted somebody else. So this is not original with Davis, but it was so good. I've told lots of people we don't have evidence-based healthcare. We have revenue-based healthcare. And I couldn't imagine that it would have been a better illustration than that ad on the tube yesterday. It was just astonishing to me. If you take this drug and it causes these problems, take this drug to deal with those problems. Okay, so let's go to solutions because that's really what this is all about. You want to reduce your risk of or recover from any of these chronic health problems. I'd like you to repeat what those chronic problems are that all have the same underlying cause, and then let's talk about solutions.
Yeah, and starting out with obesity. Today, most adults are either obese or overweight, and it's getting worse. High blood pressure. Most adults have high blood pressure, and it's getting worse. Cardiovascular disease, which is stroke or heart attack, the number one killer that you and I and most of our listeners are statistically likely to die of. Next is cancer. After that is Alzheimer's disease. And then finally, mental illness. And in the book, we make a very strong argument, and the evidence is very strong, that these diseases all have a root cause in metabolic dysfunction that essentially manifests as different ones of these diseases. Like we all don't get cancer. Some people get Alzheimer's, some people get high blood pressure, and some people get combinations of that. But the underlying mechanisms, the root cause is metabolic disease. And the fascinating thing is there's no pill for metabolic disease. There's no surgery for metabolic disease. The pills and surgery that we're given today don't really reverse the root cause. They treat the symptoms, but the cause keeps getting worse. But if you want to reverse the root cause, we can all do something with arguably the most powerful medicine that most of us will experience, and that is lifestyle, the choices we make every single day. And that comes down to, four things: food, sleep, exercise, and stress. And you get those things.
I have a question real quick.
Yeah.
What about sunshine?
Sunshine? Yeah, sunshine's important. Deficiencies, toxicities are important. Yeah, for sure.
I like to keep in my mind, there's 5 things that I have to take care of. I have to take care of sleep, stress, steel. For me, that's how I remind myself of exercise is steel. It's technically iron, but sleep, steel, stress. What's the S I use for food? I don't know. I've gone completely blank. And sunshine. All right. Expand on those things.
It's fascinating because adopting, let's say, a metabolically healthy diet, which nutrition is, one of the main drivers of lifestyle that makes us metabolically healthy. The same diet, which blew me away, will cause people to lose weight. It will lower the blood pressure. It will decrease your chance of heart attack. It will actually reverse mental illness in some patients, as Chris Palmer and Georgia Ede have shown. Yeah. It will actually reverse Alzheimer's disease in some patients, not all patients in any of these, but some it can have very dramatic effects. And even in cancer, this same type of metabolically healthy lifestyle is being added on to treatments for cancer with some very interesting suggestive results.
I'm going to suggest that folks get a hold of your book for details. That, to me, that's what makes the most sense. And we'll provide links to the book in the show notes.
Yeah, I can do one better. If they want to download the first chapter, they can download that on my website, and it's in audio form, MP3, and also PDF. So you can get started that way. Check it out before you go to the library or spend money buying it.
Awesome. We'll make sure that folks have a link to that to download the first chapter. All right. It strikes me that as many of these interviews as I've done, I have gathered, because I've done, 250 different interviews over the last three and a half years with folks like yourself, that I have learned that dysfunctional metabolism is at the root of all these things. But I don't know that I've heard any healthcare practitioner before you literally say that. All of these things have the same root. The same treatment will address all of them. So regardless of what you're dealing with, this treatment will make all of it better. Go into some details about what people believe wrongly about sleep, stress, exercise, and food. And then let's
Yeah.
talk about getting it right.
And I'll amplify one thing you said, that there are many people that have a message about metabolic health, and all coming from different spaces, like Phil Ovadia, as a cardiothoracic surgeon, somebody else is a dietitian, somebody else is an orthopedic surgeon. My background is I'm a medical school professor, so I'm coming from the establishment. I'm the cause of this.
It's your fault.
No, not me personally, but I'm part of the problem of Western medicine, and that's what we need to fix. And so hopefully, the message will ring true with different people. But yeah, the way when I went with my 4 conditions, and I went to a doctor, they gave me a pill for each one. And I said, hey, what about lifestyle? And they said, nah, it doesn't really work. You're going to be on these pills for the rest of your life, so get used to it. And that was what basically forced me to question, was there any other option? And thankfully I found out there was, and I was able to reverse these diseases. But so it was a big wake up call for me. I mean, nutrition is fundamental. You can't do anything without fixing nutrition. But the other thing is I have people who absolutely eat a perfect nutrition, but then their sleep is messed up. And sleep, you think, how can that affect your metabolism? There's a famous study where you take healthy college students and you sleep deprive them. And within a matter of a day or two, they actually become diabetic, or they have insulin resistance. They become metabolically ill. So sleep, stress, all these other things, and exercise and sunlight, they have to be put in place too. So it isn't just about a diet. And also, I don't think of it as a diet. I think of living the way I want to live for the rest of my life, so I can see my kids, grow up and see my grandkids. So it's not a diet that I go on and then I get off, but it's a choice. It's something that I embrace as my lifestyle, that I choose because I feel better when I do it. And I know it's better for my family.
We hear that over and over. My wife became convinced that she needed to stop eating wheat products, and she really didn't want that. In fact, her grandparents were wheat farmers. They have had several thousand acres of wheat farm in Colorado. So she comes from a family of farmers, and giving up wheat was psychologically difficult for her. But she literally, within 24 hours of stopping eating wheat, she said she could tell the difference. She felt better. Her joints quit. Her joints didn't work, didn't ache. Her gums, apparently wheat really affected the sensitivity of her gums. It was astonishing how fast she felt better by taking wheat products out of her diet. And I realize everybody's probably got a slightly different requirement, but it was fascinating to see that profound response to such a simple change. All right, let's talk
Yeah, I
about.
mean, each one of the things I take out too. One of the 3 things I do in my diet, and I think most people, even though I'm not gluten deficient, gluten sensitive, I don't have celiac disease, but I believe most adults, or many, if not most, have a low-grade inflammatory response to the proteins in grains, including wheat. And this drives this inflammation. It may have been responsible for what your wife had, but certainly, and hey, I love bagels. I love baked goods. I love cake, but I love my children more. And that's a no-brainer. That's easy to give up for that.
I can tell from the content of this conversation that folks are really going to want more details. So we're going to make sure that for our listeners, y'all can get the details that I know you want, detailed answers to these questions. But let's move on right now. I just want you to think about and share maybe some of the more interesting complaints and compliments you've gotten as a result of this work.
As far as complaints, I've had, gracious comments from colleagues and people on social media who disagree with my interpretation of things. And, hey, reasonable people can agree to disagree. And I want to be clear, this is not my idea. This is not me saying I'm not the authority. And in the book, I reference the peer-reviewed articles, which is the gold standard, the scientific studies that everyone could take a look at, and they can look at them for themselves. So the negative results have been just about disagreement of interpretations. And, I hope I follow the evidence. If they say that Coca-Cola is healthy and will make you live longer, that tomorrow I'll order it by the case and drink it like I used to. It was water, but I don't anymore because I believe it's very harmful.
Yeah, yeah. Any really notable compliments?
On the positive side, it just, I feel it in my heart when people say, wow, I read your book and you've changed my life, my family, my job, just my life, and that you can't ask for anything more than that.
That's as good as it gets, isn't it?
Yeah.
Yeah, that's fantastic. This is my favorite part of this little show. 8 words about health. The thought here is that you've only got one message you can deliver to help people predict, prevent, recover from a particular health problem. And the only place you can publish it is on a billboard. And the problem with billboards is people are generally driving pretty fast as they go by. We've learned in the marketing industry that about the maximum number of words you can use is 8. So you've only got 8 words. What do you say?
Lifestyle matters. It's the most important thing.
Lifestyle matters. It's the most important thing.
For your health. I mean, you could interpret that the wrong way. So I was thinking,
if you've only got 8 words, there's not gonna be a lot of subtlety and nuance. So, typically, when I have a client that's paying me to handle their marketing and their branding for them, I will have them put a URL on the billboard. So,
yeah.
So let's do that. What's the URL where we want to send folks to learn more about Lifestyle Matters?
This is easier. It's just my name, which is Robert Lufkin, my degree, MD.com, robertlufkinmd.com.
robertlufkinmd.com. Again, the details for how to download and listen to or read the first chapter of Dr. Lufkin's book will be available on the show notes. Rob, thanks for being here. This has been I think one of the most potent little interviews I've ever done, because it encapsulated the core of what it's all about, and it's going to appeal to a lot of folks.
Thanks so much, Jack. I really love your style, and I love the way that you do this interview. It's great questions, and thanks so much for what you're doing.
Likewise, sir. This has been the Predictive Health Clinic. Thanks for being with us, folks. We'll talk to you next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.